Well, hello, I'm Doug Apple, back with another special interview for you today. Did you watch the vice presidential debate? I had someone ask me, are you going to watch the vice presidential debate? I said, well, I don't really plan on it because I'm not really the kind of person that likes to see these debates based on the argumentation and the back and forth, and I would rather see something very reasonable and logical, and so debates aren't really necessarily my thing, but I like to read about them afterwards and see what was said. But we're going to find out because healthcare came up in this vice presidential debate, and we have Mike Sharman of Share Healthcare on the phone line with us. And so Mike is going to be sharing with us some of the insights. How does this affect us as we go into the voting booth? How should you vote based on the healthcare issues and based on the proposals and ideas presented by the vice presidential candidates in this debate? So, Mike Sharman, take it away.
Thank you, Doug. I wasn't able to watch the vice presidential debates either. We were in the air in an airplane, flying from one state to the other. But I was able to look up the transcripts because I was very interested in what they had to say. And it's also interesting, the news commentaries on it mentioned that this was a good, statesman-like, cordial debate in which the vice presidential candidates did not insult one another, although they challenged one another on their ideas, which is exactly what we want a debate to be.
Yeah.
And as I mentioned, I looked at the transcripts of it. And C-SPAN is supposed to be a very neutral, nonpartisan tool, but it apparently is not because they edited the transcript. And the part I was looking for was their discussion, the vice presidential candidate's discussion on the individual mandate, the part of the Affordable Care Act, Obamacare, that mandated that everybody had health insurance, and if you didn't, you got taxed, penalized for it. Well, C-SPAN edited that not the whole discussion, but only the part that mentioned individual mandate. It had the sentence before, the sentence after in each one of the candidates' discussion. So that's very disappointing and also alarming. But CBS, the network that was actually putting it on, did have the entire transcript and an accurate word-for-word transcript. So that part of it that was talking about the individual mandate and Affordable Care Act, one of the moderators, one of the interviewers, Nora O'Donnell, asked Tim Walz, she said, Governor, did enrollment under the Affordable Care Act go up under the Trump administration? And he said, well, it's higher now. And then he said, look, people are using it. The system works. Now, what system is he talking about? The fact that there's the subsidized healthcare exchange. If you are basically the number is if you're at 400% of the poverty level, you can have it subsidized. Everybody else can get it through the government healthcare health exchange program. But up to 400%, you'll get some sort of subsidy on it. What people don't really realize is there's a very high deductible. And then there's also a copay. But anyway, he says, look, people are using it. The system works. And the question about this of young people or whatever, that's the individual mandate piece of this. So obviously when you're debating, you don't, have proper syntax and everything. So he says the question about this of young people or whatever, what he means, what we can infer what he's talking about is, well, what about the healthy people? What about the people that if we had insurance as we used to, which was rated by are you healthy or are you not, the healthy people, the young people get less expensive insurance. So that's why he said that. He said the question about this of young people or whatever, that's the individual mandate piece of this. Why is that the individual mandate piece of this? Because the individual mandate makes mandates that everybody has to be part of the insurance pool, whether you want to or not. And if you can't afford it, the government will subsidize it. Well, that sounds compassionate. That sounds good. Except for the fact that if you were poor before the Affordable Care Act, the government would pay for it. Mm-hmm. Since the 1950s, we've always had a program that was federally subsidized or federally mandated that poor people could get health care. even before Medicare, there was the Hill-Burton Act. And the Hill-Burton Act said if you used any sort of federal loan or federal money to build your hospital, that hospital mandated to provide health care to the poor. You never hear about that in the debates or the arguments about, well, gee, we ought to give health care to the poor. We always have. And even before that Hill-Burton Act, that's what communities did. They built community hospitals so that people could get care. Doctors were famously known for waiving fees or having very easy payments for people who just couldn't afford it. So, taking it from the top here again, Tim Walz said, I'll start from the beginning so we're not confusing. Look, people are using it. The system works. The question about this, of young people or whatever, that's the individual mandate piece of this. And Republicans fought tooth and nail saying, well, Americans should be free to do this. Well, then what happened? All right, that's Tim Walz's full quote on that. Republicans fought tooth and nail saying, well, Americans should be free to do this. Well, yeah. And he asked, well, then what happened? So Senator Vance, Trump's vice presidential candidate, said, you think the individual mandate's a good idea? And Governor Walz responded, I think the idea of making sure the risk pool is broad enough to cover everyone, that's the only way insurance works. When it doesn't, it collapses. That's a false premise. My area has a lot of conservative Mennonite. Most are in the Amish Beachy tradition of Mennonite. And conservative Mennonites have always had medical aid programs. It's what most of the healthcare sharing programs stem from. That's their parenthood, let's say, of it. And I was chatting with a couple that are in one of our Mennonite churches nearby. And I was just asking them, how much do they, in their church-based medical aid program, how much do they pay per month? So to inform your audience, a Mennonite church, a conservative Mennonite church, and all Amish churches also, as well as Old German Baptist Brethren, the plain people, each church will have its medical aid program, meaning each church will care for one another and have each family member, or each family rather, contribute to this medical aid pool. And that's what they provide for everybody's health care from. So I asked her, I said, well, how much do y'all pay? And she said, we pay $50. And I said, oh, is that $50 per person? Because that family had 6 children. And she said, no, our church has it where it's $50 for everybody over 16. So for their family of 8, husband, wife, 6 children, they pay $100 because they don't have any kids over 16. And I said, has that been enough to take care of everybody's medical expenses? And they're in a church that's right around, 80 to 100 and some people, depending on who's moving in, who's moving out. And she said, oh, yeah. And occasionally, if the bills go into the hundreds of thousands, then we might ask another church to help us out. All right. Now, the reason I mentioned that in the context of this vice presidential debate is because Governor Tim Walz had said, I think the idea of making sure the risk pool is broad enough to cover everyone, that's the only way insurance works. When it doesn't, it collapses. No. Here you have a tiny risk pool, and they pay pennies on the dollar of whatever everybody else pays. Share Healthcare, we think we have an extremely affordable program for Christians to join to have their medical expenses shared. We're $149 for a single, $249 for a couple, $349 for a family of 4, and $50 for every child after that. So that's extraordinarily affordable compared to insurance. Well, compared to this one Mennonite church, we're expensive. So that premise that Governor Walz has, well, you got to have this huge mandated risk pool where it covers everybody in the nation. If you don't do that, it collapses. That's just false. And then he went on to say, when we're able to make it, when we're making it this way, when we incentivize people in the market, and when we help people who might not be able to afford it to get there, and make sure that when you get sick and old, it's there for you. Okay, well, we already have it when you're sick and old. Medical care is there for you. We already do. Medicaid, Medicare, CHIPS, which is the Children's Health Insurance Program, the Hill-Burton Act, all those other things. We've already done that. but he wants to make it. And he derides the Republicans who fought tooth and nail saying, well, Americans should be free to choose what they want to. When we begin coercion, when we mandate things, which is, of course, coercion, we've no longer become a nation of free people. We literally have become socialist and or communist, depending on how far it's gone. Because socialism is that the government either owns or controls the means and methods of production. Communism is the government owns and controls the means or methods of production. It's a very slight difference. What Governor Walz is talking about is the very definition of socialism, which is why when we're talking about it, it's socialized medicine. And we've taken away people's freedoms. When you take away people's freedoms, you take away all the innovation that comes with entrepreneurialism, capitalist systems, a free market. Now, a free market truly has to be free. You can't have oligarchies or monopolies, the non-governmental aspects, dictating what to do. But sometimes large capitalism helps. We've just had the mass flooding in North Carolina and elsewhere. The communication tools that people would normally have are wiped out. And what is occurring is that Elon Musk has said, well, he's going to be providing for free and putting more Starlink satellites in those areas so that people can have communication. But he wouldn't be able to do that if he wasn't a wealthy person.
Mm-hmm.
Also, in this political era, Elon Musk, having bought Twitter and renamed it X, opened up a huge media tool that in the last election had restricted people's ability to talk about politics. It had actively censored and partnered with the government to censor. Well, because Elon Musk is rich enough, he just bought the thing and changed it so that it no longer censors. We want to be able to have the freedom to succeed and to, go from being, one person can go from being a poor person to an extraordinarily wealthy person and can use it for good or ill. And when we use it for ill, that's when we do want government to step in and protect the public from evildoers. And we also need then to have our elected representatives know the difference between good and evil. And so that they be able to set up the laws that do that or enforce the laws that do. There was a part of the vice presidential debate on abortion, and Governor Walz had used the example of a woman who could not get, he had said she couldn't get abortion care in her state because abortion had been legislated out. And so she had to go to another state where she died. Okay, so that was his story, is that this woman who was going to get an abortion couldn't in her state, and so she went into another state and died. The only problem is that was false. And you're telling a lie, that's evil. That woman was not going for an abortion. She had gotten the abortion pill and had complications from it. The abortion pill now is a over-the-counter drug. And a lot of people are having illnesses and fatalities from it because they aren't using it or having aftercare as they should. Now, every state allows a woman to have care when she's in literally a medical hazard. Here she's having a problem because of what the abortion pill did to her. Every state allows care for that. There's no restriction on that. There is a restriction on terminating a living life of that child. But here we had the governor talking about that issue of, well, this is an abortion, and here's an abortion issue, and here's the death that resulted. No, it resulted because the pro-abortion people wanted to make the abortion pill more widely available, and without having any of the protections. Remember the mantra about abortion used to be from the pro-abortion people, they want to make it safe, legal, and rare? Mm-hmm. Well, they've made it legal, but it's not safe and it's not rare. And for those of your listeners that don't know, one of the reasons that share healthcare is very affordable is because we try to have the medically necessary expenses shared, but not those things that would be contrary to what God would want. God is for life, and so we don't share in abortion. We don't share in those abortifacients like what killed that woman. There's a number of articles that have just been coming out this past week of the harm that's now scientifically shown in different studies, on the harm of transgendering, which anybody with common sense can figure that out. You can't have a person born one way trying to have everything go the opposite way, not have the body in conflict. So we don't pay for any of that gender destruction care. We're non-smokers, alcohol only in moderation, 1 to 3 drinks per week. So those things, it just makes sense. And then with that, we share in all the other medically necessary expenses. And also because we're sharing, sometimes people who might be able to send in a medical bill, it's the sharing. So if you have a medical bill, send it in. Well, sometimes people won't. They just choose not to because we're a community as opposed to a contractual relationship. That makes a huge difference.
Well, with regular insurance, you hear people say things like, the wind blew the shingles off my roof, but I'm not even going to turn it in because they're going to raise my rates. I don't suppose anybody doesn't turn something into share healthcare with the fear of getting their rates raised. No,
that's not even a component of how we price things, but we had set up a pricing structure, that 149, 249, 349 pricing structure, looking at what would we think it would actually cost to make sure everybody's needs are met. And from pre-COVID on, we've never needed to raise it, whether an individual or not. I mean, we aren't going to raise any individual's expenses. If we ever did raise the monthly amount, it would be with everybody. But we haven't needed to, and we still don't need to, even though healthcare and health insurance expenses and health hospitalization and medical provider expenses have gone up quite a bit since the Biden-Harris administration was inaugurated. We haven't needed to raise rates. In fact, we still have a surplus above what people send in, and so that's held in that trust fund at the bank. So that what I'm saying is 149, 249, 349 is more than enough to take care of everybody's medical expenses.
So as we wrap up our time here together, just give the people a quick elevator speech about share healthcare and how it might apply to them, and if they're interested, what they can do about it.
Well, for employers, small employers, they might want to do something for their employees for healthcare. It might be a Christian business and they got 3, 4, 5, 10 workers, but they don't really have the ability, the budget ability to pay for insurance for them. So they can help their members. They could bonus them that amount. To use it as an example, an employer could say, well, I'm going to bonus all my employees $400 a month. Use it for healthcare as you want. And if you want to use it to be a share healthcare member, then we'll send in the money for you. We'll facilitate that, make it easy for you. But you will be the member. And that's good for the employee, because if they choose to leave and go to another employer, start their own business, whatever, then they are still a member. And so they get to take that with them. For people who are there self-employed, this is perfect for them. We have a whole lot of homesteaders that really appreciate this, because homesteaders are trying to be self-sufficient as much as possible. We have a lot of homeschoolers also for that same reason, is that they want to begin learning how to develop their own system, how to begin doing things that are non-governmentally mandated. And then, of course, with homeschoolers and homesteaders, their incomes may not be as high as their next-door neighbor. And so they're looking on how to budget, and this helps them a great deal.
And so what do they need to do to find more information?
Well, go online. It's sharehealthcare.com. Real simple. Remember our name, Share Healthcare. It's what we do. It's who we are. sharehealthcare.com, or they can call 1-844-SHARE-HC, 1-844-SHARE-HC.
And just as a final note, you said that, what was it? C-SPAN did not have the accurate transcript of the vice presidential debate. Where did you find that accurate transcript?
With CBS.
Oh, CBS. Okay.
Yeah. We're all lambasting network TV often, but they gave a truthful, accurate transcript.
Yay. At least as of the time you looked at it.
That's true. That's true.
All right. Well, that's Mike Sharman with Share Healthcare. Again, their website, sharehealthcare.com. And for Wave 94, I'm Doug Apple.